newest entry in the RX Hope series on our website. Sorry, more people joining. That's great. I know it seems a little odd to, oh, can you not see me?
To you just because your last name. And what?
I can't see myself on my screen anymore. Can you see me, Leah?
There's something covering your camera.
Oh, there you go. That would be my piece of paper. I'm glad I don't have to do this every day. Anyway, I know it seems a little odd to celebrate a disease that has such devastating consequences and has taken so many people from us, most recently a sweet little girl named Callie. And but it's important to have a day that we've kind of stretched out to a month now, but to bring all our stakeholders together and to celebrate all the inch stones that we've reached and the milestones that we're achieving and going to achieve. It's a day of gratitude, and we thank all of you for your part in building this strong community. As I said, we're in our 10th year as a foundation. We started Awareness Day in 2017. The date was chosen for the location of the gene on the long arm of chromosome 2 at position 24.3. I kind of wish it was at position chromosome 5, so it'd be a little warmer here when we celebrate, but it works for other parts of the world. So our purpose is in the title, raising awareness. The impact of raising awareness is far-reaching and has brought us to where we are today. And that's why we celebrated. You're going to hear a lot about where we've been recently and where we're going from Leah, Sean, and Al in a few minutes. And just to make it brief, we raise awareness because it leads to people caring about our disease, and that leads to interest in research, which leads to action of actual research happening and funding, and then ultimately cures. As you know, well, no, sorry, skip ahead. Our mission and vision are what drives us every day. Our mission is to accelerate research, build community, and advocate to improve the lives of those affected by SCN2A related disorders around the world. And our vision is a world with effective treatments and cures for all SCN2A related disorders. And we live by our values of urgency, integrity, collaboration, and inclusion every day while we are working for you, our community. And as you know, families is in our name for a reason. SRDs affect the quality of life of the entire family. Of all the amazing work that's been done in the last 10 years, I always say I'm most proud of the community that we've built. From a few parents who were told that we were alone and no one else had this diagnosis, to now getting that genetic test report back and immediately having a place to go for support from people who get it, wherever you are in your journey, it's priceless. And without that community, the science, the interest in studying SCN2A would not have been possible. When we started, we had to hunt down researchers. Leah is masterful at connecting collaborators. And after years of raising awareness, now the tables have turned and researchers and companies are seeking us out as collaborators. Now I'm going to invite our intrepid executive director, Leah Myers, to tell you more.
Thanks, Jenny. So hello, everyone. Thank you so much for being here today on our big day. I'm Leah Myers. I'm one of the founders. I'm also the executive director for the Families SCN2A Foundation, and I'm going to lead you through a few slides here, just highlighting some of the exciting initiatives planned for this year. Let's see, you could go to the next slide, please. So today's International SCN2A Awareness Day, international being a keyword. For the second year in a row, we have collaborated with other patient groups outside of the US to design an awareness campaign around SCN2A and SCN2A Day. And this year we featured 24 beautiful SCN2A warriors, each from a different country, in an exciting countdown to today, International SCN2A Awareness Day. If you aren't already following our public pages on social media, please do so you can be amongst the first to know about all of the exciting updates and progress. Next slide. Strategic planning. So the board and the staff, along with several volunteer committee members, have begun the intense work of strategic planning for our next strategic plan, which will be 2026 through 2029. And we really appreciate the participation of so many of you with sharing feedback to us, giving us input, and helping us shape the foundation's goals for the next 3 years. And with that being said, be on the lookout because you'll be getting a few more opportunities like that to help us prioritize these goals. You might ask, why is strategic planning so critical? And while we recognize the need to stay flexible and pivot when necessary, we seek to maximize every single dollar our donors entrust us with. So we must stay laser focused on the areas that we can have the largest impact in. This strategic plan allows us to evaluate every single opportunity in a tactical manner to keep our team focused on the goal or the endpoint. As much as we'd like, we can't do everything, but we are determined to make everything we do have the largest impact. Next slide, please. Seize the moment. Our team is laser focused with a mission to accelerate cutting edge research while also building and supporting a global community of affected families. For those of you who do not know, the foundation was founded in 2015 by parents who recognized that if we don't take these matters into our own hands, no one else would. In the past decade, we have accomplished unprecedented milestones. Today, the foundation is seizing an immediate opportunity to accelerate all of this groundwork that we've laid over the last 10 years. Incredible breakthroughs in medical technology, including gene therapy, are rapidly evolving, and now is the time to act. Seize the Moment is our powerful call to action in this year's annual campaign, which kicks off today, and it kicks off our 10th year. We've been here a decade now, and we have a really great goal of raising $100,000 by April 1st to make a transformational impact on the lives of those families living with an SCN2A related disorder. Go ahead and scan that QR code and take a moment to read more and pledge to give a gift of hope today. Everyone get it? Okay, good. Next slide, please. So how do we support our fast-growing family community?
Están haciendo casi un poco, porque yo solo veía mi programa.
Brooke's Birthday Club.
That's okay. We do this through programs. So first of all, we treat our families, our community, like family, because remember what Jenny said, families isn't our name for a reason. That's not an accident. The foundation has initiated these several programs to reach families where they are and help them in the unique way that they need, whether it be through financial assistance or local support groups where they feel less isolated. And we celebrate our warriors every chance we get because we know all too well that tomorrow is not promised. Here are just a few of our programs. You can visit our website at scn2a.org for a complete list and apply for support today. Next slide, please. Our conference is probably one of my favorite programs. It has grown significantly over the last several years. So this SCN2A Family and Professional Conferences last year alone had 375 in person and 125 joined virtually. And this year we expect it to grow to 400 at least. The focus of this annual conference is to bring together the scientific, medical, and patient communities to learn from one another in order to further the goal of finding better treatments and cures for all SCN2A related disorders. The conference format includes live presentations, informal social gatherings, and question and answer opportunities where patients and medical professionals can have deeper individual conversations. Some of the professional presentations will focus on current research, drug development, clinical trials, diagnostic considerations, and the best clinical practices for treating the varied phenotypes and symptoms associated with SCN2A related disorders. In addition, there'll be live and recorded presentations by families, which I think might be my favorite part of the conference. These families that are affected by SCN2A, and they illustrate the daily challenges of living with this condition. Over the course of the conference, which is 3 days, scientists who are currently researching SCN2A will have the opportunity to update clinicians, therapists, industry groups, and families on their progress, sharing both published and unpublished data. Industry will have the opportunity to learn firsthand from both those afflicted with the SCN2A related disorders and their families. We encourage the exchange of ideas and information by all attendees and believe strongly in the value of professionals meeting families outside of a medical setting. Getting to know a family's personal story of diagnosis and treatment is a really positive step in educating practitioners to manage current and future SCN2A patients and in motivating researchers to keep working hard in their labs to find cures. Also, just a quick note, registration has opened today, and we will be closing it at 400 because we are limited in space this year. Next slide. Participation. Participation in research is our greatest hope for better treatments and cures for all SCN2A related disorders. To accelerate research, the best thing patients and their families can do is to learn about SCN2A and their specific variant and the available research projects that are out right now. Today's a day to brag, so I'm going to brag about our families. And when it comes to being actively involved, our community rocks it in every way. While it may not seem like a big deal to take part in research projects where scientists are just collecting data, either from a survey or a wearable device, this research is the most crucial to defining, it's so crucial to defining the disorder, designing clinical trials, and convincing the regulators of the unmet need in SCN2A. Because of your participation, clinical trials have a better chance of succeeding, and you are accelerating getting treatments to kids. The Dragonfly study is an evergreen natural history study for SCN2A that is already leading the way towards better treatments. The Foundation's ultimate goal with this study is to ensure that the data is accessible to researchers and industry groups worldwide. Data is not useful if it is hidden behind barriers. Participate today. Go ahead and scan that QR code. All right, well, I hope you liked the sampling of what's going on at the Foundation, and I'm going to turn this over to Sean.
Thank you, Leah. My name is Sean Egan, and I'm the dad of an 8-year-old little girl named Harper with SCN2A. I'm also the acting chief scientific officer of the family's SCN2A Foundation. And I've been tasked today to give a snapshot of the state of the research for SCN2A. But before I start, I just wanted to say Happy International SCN2A Day to everyone on the call and everyone watching after the fact. It's an important day that we celebrate and cherish at Families SCN2A. Next slide, please. Wanted to take a brief moment to both introduce and celebrate our team that's working tirelessly for each of you. Our team for accelerating science and clinical outcomes. We call ourselves TASCO. Brad Bryan, Christina Saninocencio, Vanessa Bender, Jeffrey Cottrell, Melody Kaiser, Eloise Austin, and Karen Ho. You've seen many of them at our conferences in the past, but next time you see them, ask them about what they're doing every day, and also say thank you for the work that they're doing. They're working daily to advance our vision of a world with effective treatments and cures for all SCN2A related disorders. Next slide, please. A few quick big TASCO initiatives that I want to highlight to be on your radar. Leah already mentioned our evergreen natural history study, the Dragonfly study, but it's an important thing to both scan that QR code and participate in. Also upcoming is our SCN2A mortality study to allow us to better understand what's driving morbidity and mortality in SCN2A, a really important study for our better understanding of what SCN2A is. We have two major funding opportunities that the RFPs actually open up today, February 24th. Our Action Potential, which is a grant that we give for young investigators looking to establish a career studying SCN2A for their future, and a brand new grant program called our Accelerator Program, which we're directly funding for-profit companies that are looking to develop drugs for SCN2A. Both of these RFPs open up today. But before I kind of move on to the next item, for families that are interested in directly funding research, please reach out to us. We now have mechanisms to evaluate the research and help manage those opportunities. Other big initiatives that we have ongoing that are really important. We announced today a partnership with a company named Selectricon. This is a really important initiative to develop a best-in-class assay, which means a test, to evaluate drugs that could potentially lead to treatments and cures for SCN2A in a high-throughput fashion. We believe that this partnership and Selectricon's expertise will really accelerate the time to new treatments and cures for SCN2A. We're also working tirelessly towards an ICD-10 code for SCN2A, An ICD-10 code is a diagnostic code that your clinician uses to code what SCN2A is within their electronic medical records. It enables a better understanding of the disease, and it allows and facilitates additional research as well. We hope to have that by the end of the year, and we're working hard towards it. We are also building SCN2A awareness with regulators such as the FDA and European and other countries, to help them understand what SCN2A is and what it means from the patient and family perspective as well. Next slide, please. Now on the snapshot of where we are with the science. And the big takeaway is that science is accelerating. Next slide, please. So this is publications over a year on SCN2A when searched through PubMed in peer-reviewed literature. This is a key performance indicator of how much knowledge exists in the realm of SCN2A. And as you can see, it's grown steadily year over year. But when you look at 2023 on the far right to 2024, it was a 46% increase in the number of peer-reviewed publications for 2024. It's a major increase, and that in 2024 represents our best year to date for adding to the field of SCN2A knowledge. Next slide, please. What were those publications investigating? What was being published and what was learned? Well, our top themes that were published on were genotype, phenotype. So how do the genetics contribute to the clinical presentation of our children? Therapeutics, representing 18% of the publications. Neurology and neurobiology, representing 18%. Clinical evaluation of SCN2A and how to better clinically manage, 13%. And then subsequently, diagnostics, endpoint development, experimental models, incidence and prevalence, and prognostic significance. These are all really critical elements needed to build the infrastructure to support drug development and better management and treatment of SCN2A. Next slide, please. But I want to highlight that these aren't just scientists and clinicians that are doing these. The community is making a major difference. Next slide. And I want to present one quick case study of how you, the community, is making a huge difference in amplifying what we know for SCN2A. Simon Searchlight was our first patient registry. A lot of our community signed up for Simon's, and that led to a research database. That database was then evaluated and published on back in 2021. And that publication's result were that there were deficiencies in clinical trial readiness for non-seizure outcomes. This led to the Families SCN2A funding and supporting a clinical trial readiness study, or our CTRS. Many members in our community participated in this study, and this study led to an aggregation of a lot of additional data. But on the heels of that, a whole host of additional publications have come out over the past 2 years that have helped us better understand how to evaluate what SCN2A is, instruments that we can use to evaluate what it looks like and how to test for it, how we can assess communication with our individuals that are nonverbal, how we could measure cognition with an SCN2A. I could go on and on about all the different elements that we've learned from this clinical trial readiness study. But as a whole, without this study and your participation, we would not have been able to take these steps forward, which then helps with subsequent drug development and being able to classify what SCN2A looks like. Next slide, please. On to therapeutics. Well, our pipeline is deep with new potential therapeutics for our whole community. Next slide. This slide represents a pipeline chart of different drugs that are in development for SCN2A or could treat SCN2A. As a quick reminder, drugs first start in the discovery phase where they're evaluated whether they have potential. They then move on to a preclinical phase where they're tested in animal models and also cell line models to evaluate their potential. After they receive a sufficient amount of evidence, they then progress on to the clinic where they are evaluated within us humans. In those human clinical trials, it starts with phase 1, then advances to phase 2, phase 3, and if there is sufficient body of data suggesting that the efficacy and safety profile is sufficient, it will then go on to be approved. Well, we now have drugs for all SCN2A with seizures, and some of these are in late stage development, phase 3, meaning that if that phase 3 trial is successful, they could go on to be approved and commercially available. We have a host of drugs in phase 2 development, and that's for all seizures and gain of function and autism. So these will require a successful phase 2 and then a positive phase 3 before being commercialized. We have N-of-1 studies in phase 1 development, as well as another drug for gain of function, SCN2A, by Neurocrine in phase 1. Each of these represent potential opportunities if your goals of care align with participating in clinical trials, opportunities for us to enroll in a clinical trial and test a novel therapeutic in our child. Then there are a host of drugs in earlier stage development, preclinical and discovery. Many of these are for our loss of function patient population, and a number of companies that are still in stealth mode that we can't disclose much more about their program. But as a whole, the future is looking very bright with many therapeutics in current development. Next slide, please. On to clinical care. Well, we're driving improvement for clinical care as well. We have a new announcement today that we're excited to share. Next slide. We are excited to announce that we have expanded our multidisciplinary network, and I see Megan on the line. You can wave, Megan. Megan will be championing our next multidisciplinary center at Children's Hospital Colorado Neurogenetics Clinic. This represents now we have UTH Houston and Colorado Children's, and these will be sites where we can get great quality care, comprehensive care for our child. And they also represent sites where cutting edge research can be participated in to help continue to build our infrastructure for SCN2A. Next slide, please. And now it's my pleasure to introduce Dr. Al George. Dr. Al George is a member of our Medical and Scientific Advisory Board, and he serves as the chair of the Department of Pharmacology and director of Center of Pharmacogenomics at Northwestern University. Dr. George?
Thank you, Sean, and congratulations to the foundation on 10 years of service to the community. I remember fondly in 2015 when we hosted the inaugural professional and family conference at Lurie Children's Hospital, and maybe we had 40 people there. I don't remember the count, but certainly now you have to cap at 400. And that speaks loudly for the engagement that you've promoted in the community and the excitement and interest in the research community for contributing to advances in this condition. I'm here to just tell you about an online, freely available resource that came out in December after about a year and a half of work by a collection of about 14 individuals who put together the state of knowledge of SCN2A related disorders. And this is a small book that was promoted by Cambridge University Press, who does medical publishing. And they have a series of publications that they call their Elements series. Starting just a couple of years ago, we contributed to founding the first ever medical and biomedical science issues for them. And these have been focused on the genetics in epilepsy. And the second gene-related topic that was published was SCN2A. And I think that the QR code and what was just posted in the chat, thank you for doing that, I was about to do it myself, is freely available online. This book contains 4 chapters, 4 sections. The first was written by Leah and her colleagues from Families SCN2A, and it provides the perspective on this disorder from the family and foundation perspective. That's including a video with testimonials from parents about their children. The second section is all about the clinical manifestations of the disorder in its various forms, and that was written by experienced clinicians. The third section is all about the basic science, about the gene, the sodium channel encoded by the gene, its function, and its physiology. And then lastly, there's a section on treatment, current treatment and future treatment. And I will give a shout out to Megan Abbott also for contributing to that particular chapter. So thank you, Megan. This is free. Now, if you want a physical copy, which isn't as exciting as the online copy, because online you can get videos of family testimonials and interviews with important people in the field. But if you do want a book and perhaps gifting it to someone you, maybe your child's physician or someone else who you think would benefit from having it, it's $22 and you can order it online. I get no royalty, by the way. I'm just promoting that in case someone was interested. But the book is free online. I would encourage everyone to go and have a look, and you can even download parts of it if you'd like. So I think the major value of this is to get the word out, is to educate physicians who are new to SCN2A. I would share this with all your children's physicians, first of all. Second of all, I hope the word gets out to physicians in training who are interested in learning about the disorder and can use this as a reference. And finally, I hope it reaches new families as well, and hopefully it helps them understand a new diagnosis. Now, I want to also just put a plug in for advocacy, not just for studying SCN2A, but we are at a critical time in medical research in this country. As some of you probably have followed the news, there has really been an assault on the NIH, the National Institutes of Health, which is the major funder of biomedical research in the United States. And it's now really in peril of going backwards in time to a place when we really didn't have the funds to do major transformative discoveries that we would like to do today. And I will also say that when funding at the National Institutes of Health is cut or reduced, sadly, the first types of research that are not funded are related to rare diseases. Those are the first to go. So I think it's not hyperbole to say that calling your Congress representatives, your senators, and advocating for continued strong funding of National Institutes of Health is cost effective. There's a great return on investment. It's a job creator, and it saves lives, and literally saves lives every day. So I think this is an important point to point out. Sorry to take a little extra time. Thank you.
Al, thank you for bringing that up. And I would like to follow up by saying that that is going to be one of the emails we'll be sending out soon on some instructions on how to take action right now. So thank you so much for leading that. Jenny, did you have any last slides?
I do. I wanted to bring this back up with a challenge for everyone to share our campaign and just tell your story to someone today or in the next week. If you're shy about sharing your own story, share the foundation's story. But keep raising awareness every day. And as Al said, call your congressman and tell them how you feel. We can't afford to have any funding sources cut. And thank you all for joining us today. We wouldn't be here without this wonderful community of not just patients, but our researchers and scientists and clinicians. We're all in this together, and we appreciate you all. Now I'm going to open it up for questions.
If you have a question, you can either raise your hand, there's a button on the bottom, or you can type it into chat and we'll read it out loud for you.
I'm going to stop sharing.
Okay, and I'm going to stop the recording now.